Part 1. Key concepts and basic questions. 1. Need for repopulation. Population redistribution. Population redistribution ensures equitable resource use and better living conditions. This involves shifting populations from high-density to low-density areas to avoid overcrowding, resource depletion, and poor quality of life. Importance: reduces the strain on overpopulated urban areas. Enhances economic development in underdeveloped regions. Supports better infrastructure planning and development. 2. Components of population structure. Population structure is divided into key parts. Age composition. How many people belong to different age groups, e.g., children, adults, elderly. Sex ratio. Number of males per 100 females in a population. Dependency ratio. Ratio of dependents, age groups 0 to 14 and 65 plus, to the working age population, 15 to 64. 3. Importance of age structure of population. Age structure affects the economy, planning, and social services. Youthful populations. More schools, jobs, and training programs are required. Aging populations. Greater focus on healthcare, pensions, and elder care. Hatch. Example. Countries like Japan face challenges due to aging, while nations like India benefit from a large youth population, termed a demographic dividend. 4. Advantages of demographic transition theory. This theory explains how populations change from high birth and death rates to low birth and death rates as countries develop. Benefits. Helps governments plan healthcare and education based on population stages. Explains shifts in population growth and economic development over time. Stages. High birth and death rates, declining death rates, declining birth rates, stable population. 5. Importance of life table. Life tables give a snapshot of mortality and survival patterns in a population. Uses. Public health. Identify at-risk groups for focused interventions. Actuarial science helps calculate pensions, insurance policies, etc. Tracks changes in population life expectancy over time. Would you like me to proceed with Part 2, or focus on a specific topic here? Tash Part 2, detailed explanation on further concepts. 6. Rohingya refugees and forced migration in Bangladesh. Bangladesh hosts a large number of Rohingya refugees who fled from Myanmar due to violence and persecution. Forced migration occurs when individuals or groups are compelled to move due to factors like conflict, war, or human rights violations. Impact on Bangladesh. Population pressure. Adds significant strain to resources, healthcare, and housing. Cultural tension. Social integration challenges with local communities. Government responses. Bangladesh provides refuge but faces difficulties like overcrowding in camps and dependence on international aid. 7. Perspectives in population geography. Population geography has a variety of perspectives based on how populations are influenced by geographic factors. Here are some key approaches. Environmental approach. How geographical features, climate, terrain, influence where people live. Social approach. Considers social factors like policies, culture, and migration in population distribution. Economic approach. Looks at the role of economic opportunities, jobs, industries in shaping population trends. Political approach. Focuses on government policies and their effects on population movement and structure. 8. Different methods of population census. A population census is a detailed count and record of people in a region. There are various methods of conducting this. De facto method. Records the population according to the location they are present in at the time of the census. De jure method. Counts the population based on their usual place of residence, regardless of where they are during the census. Tools and techniques. Self-report forms and house-to-house visits to gather information. Technological tools, such as Geographic Information System, GIS, to map population data. 9. Determinants of population distribution. Population distribution refers to the spread of people across the globe. This is affected by various factors. Physical factors. Climate, fertile soil, water availability, etc. Example, people tend to live in temperate climates or along river valleys like the Nile. Economic factors. Availability of jobs and resources like mineral deposits. Example, urban areas like New York attract people because of job opportunities. Social and cultural factors, the presence of a community, education systems, and cultural attractions. Political factors, government policies, borders, and migration laws. Effect on population density. These factors influence the concentration of people, meaning certain regions may have very high or low population density. For example, China's eastern coastal areas have a high density due to fertile land and economic opportunities. 10. Types of population. Age-sex pyramids. Age-sex pyramids visually represent the distribution of different age groups and sexes in a population. They offer insights into population trends, economic challenges, and future demands. Expansive pyramid. High birth and death rates, typically found in developing countries. Example, high number of children and lower numbers in elderly, often seen in countries like Nigeria. Constrictive pyramid. Low birth rates and low death rates, indicating population aging, found in more developed countries. Example, Japan has a constrictive pyramid due to an aging population. Stationary pyramid. Birth rates equal death rates, representing stable population growth. Example, some European countries with stable birth and death rates. Would you like to move to part 3, where I can continue explaining part 3, further exploration of concepts. 11. Demographic transition theory and Bangladesh's position. The demographic transition theory explains population changes as a country develops from a pre-industrial to an industrialized economy. Stages of the theory. Stage 1, high birth and death rates, population growth is minimal. Stage 2, death rates decline due to better healthcare and sanitation. Birth rates remain high, leading to rapid population growth. Stage 3, birth rates decline as people adapt to changing economic conditions and cultural norms. Population growth slows. Stage 4, low birth and death rates stabilize population size. Stage 5, optional. Birth rates fall below death rates, leading to population decline. Bangladesh's position. Bangladesh is currently in Stage 2, transitioning to Stage 3. Improved healthcare and reduced infant mortality have decreased death rates. Population growth is slowing as education and awareness about family planning spread. 12. Population dynamics, definition and components. Population dynamics refers to the changes in population size, structure, and distribution over time. Key components: birth rate, the number of live births per 1,000 people annually. Death rate, the number of deaths per 1,000 people annually. Migration, movement of people into immigration or out of emigration, a region. These components influence a region's overall growth rate, age structure, and resource needs. 13. Methods of population projections. Population projection estimates future population growth based on current trends in fertility, mortality, and migration. Common methods, arithmetic growth, assumes a fixed annual increase. Example, adding a constant number of people each year to the population. Geometric growth assumes a constant percentage growth rate. Example, doubling population in regular intervals. Cohort component method uses data on age, sex, fertility, and mortality for detailed predictions. Exponential growth assumes population grows proportionally to its current size. Importance helps governments plan for resources, healthcare, and infrastructure needs. 14. Government measures to prevent population explosion in Bangladesh. Bangladesh faces significant challenges due to its dense population. The government has implemented several strategies to control population growth. Family planning programs, promoting contraceptives and educating citizens about family size. Healthcare improvements, reducing infant mortality encourages smaller families. Female empowerment, supporting education and job opportunities for women reduces early marriages and high fertility rates. Awareness campaigns, promoting delayed marriages and spacing between children. Outcomes. These efforts have led to a declining growth rate, but further measures are needed for long-term sustainability. 15. Importance of population redistribution. Population redistribution refers to shifting people from densely populated areas to less crowded regions. Why it's important. Reduces pressure on urban areas. Large cities like Dhaka and Mumbai face overpopulation, leading to housing shortages and poor quality of life. Encourages regional development. Relocating people can boost economic growth in underdeveloped areas. Resource utilization. Redistribution ensures better access to resources, jobs, and services. Challenges. Requires proper infrastructure in destination areas. Cultural and social integration of relocated populations can be complex. Would you like more detailed insights or examples related to these points? Part 4. Advanced Concepts in Population Geography. 16. Age-sex pyramid, types and their interpretation. The age-sex pyramid, or population pyramid, is a graphical representation of population distribution by age and gender. Types of age-sex pyramids: expansive pyramid, broad base, indicates high birth rates and a growing young population, seen in developing countries like Bangladesh. Stationary pyramid, almost equal proportions across age groups, tapering at the top, found in developed countries with stable populations like Sweden. Constrictive pyramid, narrow base, lower birth rates and higher life expectancy, common in aging societies like Japan. Population insights. Economic planning helps identify workforce availability and dependency ratios. Health and education reveals the need for schools, hospitals, and elderly care services. Development trends predicts future growth or decline. 17. Population dynamics, determinants of population distribution and density. Population density refers to how many people live in a specific area. Several factors influence it. Physical factors. Climate. Favorable climates attract higher populations, e.g., river valleys. Topography. Flat and fertile lands support dense populations. Resources. Areas rich in resources, e.g., coal, water, attract settlements. Human factors. Economic opportunities. Cities with industries and jobs attract more people. Political stability. Regions with peace and stability are more densely populated. Infrastructure. Better transport and services support higher densities. Effect on population density. Uneven distribution causes overpopulation in cities while rural areas remain underdeveloped. Resource scarcity in densely populated areas leads to lower living standards. 18. Demographic transition theory, advantages and implications. The demographic transition theory is a valuable tool to analyze and predict population trends. Advantages: explains growth phases, describes shifts in birth and death rates over time, supports policymaking, guides governments in planning healthcare, education, and urbanization, highlights development levels, helps identify whether a nation is in pre-industrial, industrial, or post-industrial stages, encourages sustainability, encourages balancing population growth with resources. Bangladesh's context, positioned between stages 2 and 3, addressing challenges like high birth rates while enjoying improved health indicators. 19. Life tables. Importance in population studies. A life table provides statistical details on mortality rates and life expectancy within a population. Uses of life tables. Public health planning helps design healthcare systems based on mortality data. Retirement plans assists in calculating pensions and insurance policies. Population projections helps predict future population trends and their impacts. Components of a life table: age-specific mortality, probability of death at each age, survivor rate, proportion of people who survive from one age to another, life expectancy, average years an individual is expected to live. 20. Impact of forced migration, the Rohingya refugee crisis. Forced migration occurs when people are compelled to leave their homes due to conflicts, natural disasters, or persecution. Rohingya refugees in Bangladesh. Background: fleeing violence in Myanmar, over 1 million Rohingya have sought refuge in Bangladesh. Barriers: overcrowded refugee camps like Cox's Bazar, strained resources such as food, water, and healthcare, lack of permanent solutions to their status. Impact on Bangladesh: increases population density in already congested areas, puts pressure on social, economic, and environmental systems. Let me know if you want further elaboration on any specific point or example. Part 5. Advanced Applications and Government Initiatives. 21. Population Geography, Approaches for Learning and Policy Formulation. Studying population geography gives valuable insights for managing resources, urban planning, and global sustainability. Key approaches: geographical analysis, Mapping population trends helps identify underdeveloped areas needing more attention. Data interpretation. Understanding data through age-sex pyramids, census reports, and growth rates improves decision-making. Cultural context identifies social and cultural factors influencing birth, death, and migration. Relevance to Bangladesh. Population geography lessons help balance growth and plan for future development challenges. 22. Population projection methods. Population projection estimates future population growth based on existing trends. Methods. Mathematical models. Linear projection assumes steady growth rates. Exponential models consider compounding changes in growth rates. Component method breaks projections into fertility, mortality, and migration components for more accurate results. Cohort analysis tracks age groups over time to predict workforce or healthcare needs. Importance for Bangladesh. Projection helps policymakers allocate resources effectively, plan urban expansion, and mitigate overcrowding. 23. Steps to prevent population explosion in Bangladesh. Bangladesh's government has implemented several strategies to address its rapid population growth. Government initiatives, family planning programs, promoting contraceptives, and providing healthcare access in rural areas. Campaigns to reduce early marriage and raise awareness about small families. Education initiatives, increasing literacy rates, particularly among women, to delay childbearing. Economic policies. Creating job opportunities reduces the economic incentive for large families. Healthcare improvements. Reducing infant mortality rates ensures fewer families feel the need for more children. Impact. These initiatives have gradually brought down fertility rates and population growth rates over the years. 24. Importance of population structure in economic development. Population structure, the distribution of a population across age groups and gender, plays a vital role in a country's economy. Examples of impacts: young population, 0 to 14 years, high dependency ratio requiring investments in education and healthcare, working age population, 15-64 years, drives economic growth if educated and employed, the demographic dividend. Large working populations can lead to rapid GDP growth. Aging population, 65 plus years, higher healthcare costs, and pension demands. Bangladesh's situation. A growing workforce is a strength, but training and creating jobs are critical to fully leveraging the demographic dividend. 25. Role of literacy in population geography. The literacy rate affects fertility, health awareness, and economic productivity in any country. Bangladesh's literacy rate, at around 74%, it helps lower fertility rates and empower women through education. Advantages of improving literacy: lower fertility rates. Educated populations tend to have smaller families. Better healthcare. Informed individuals adopt healthier lifestyles and access medical services. Economic growth. Literacy boosts job skills, innovation, and productivity. Future outlook. Focusing on education is key to sustaining positive demographic and economic changes. With this, Now Part 5. Key elements, measures, and broader implications. 26. Importance of demographic transition theory, DTT. The demographic transition theory explains population growth through economic and social development in 4 stages. Stages of DTT. 1. High stationary, high birth and death rates, slow growth. 2. Early expanding, declining death rates, continued high birth rates, rapid growth. 3. Late expanding, declining birth rates, moderate growth. 4. Low stationary, low birth and death rates, stagnant or declining growth. Advantages of DTT. Guides countries in policymaking for population management. Predicts healthcare needs and education investments for different stages. Provides a framework for understanding how development reduces population growth rates. 27. Population mobility. Dynamics. Population mobility describes the movement of people between areas for better opportunities or survival. Components. 1. Migration. Movement across national or regional boundaries. 2. Commuting. Daily travel for work or education. 3. Circulation. Short-term moves like seasonal migration for agriculture or labor. Importance for Bangladesh. Rural to urban migration has rapidly increased population density in cities like Dhaka, putting immense pressure on resources. 28. Life table importance. The life table summarizes survival and mortality rates for different age groups in a population. Uses of life tables helps measure life expectancy and assess health systems, determines pension schemes and healthcare planning, tracks infant mortality and diseases. For Bangladesh, improved life expectancy reflects better healthcare, but disparities between urban and rural areas still need attention. 29. Government measures to control population growth. Bangladesh has undertaken significant steps to manage its population explosion. Family planning programs, free contraceptive distribution in urban and rural areas, education campaigns promoting smaller families. Health interventions. Addressing infant mortality encourages smaller families. Investments in maternal health prevent high-risk pregnancies. Women's empowerment, encouraging female education and workforce participation, delaying early marriages. Outcomes. While fertility rates have dropped, further efforts are needed to ensure sustainable growth. 30. Analyzing population trends through age-sex pyramids. Age-sex pyramids graphically represent a population's age and gender distribution. Types. 1. Expansive pyramid, large base, high young population, developing countries. 2. Constrictive pyramid, narrowing base, aging population, developed countries. 3. Stable pyramid, equal proportions among all age groups, e.g., developed but balanced. Implications for Bangladesh. Bangladesh's pyramid shows a growing working age population, signaling an opportunity for economic growth if investments in education and job creation align with this demographic. Let me know if you want to expand or revisit any concepts.